Good morning, everyone. Thank you for joining us today. This is the Rock County Public Health Media Briefing for January 6th, 2022. This briefing is being streamed live on the Rock County Public Health Department's Facebook page. The recording will be available afterwards on our Facebook page and also our YouTube channel. My name is Jessica Turner. I am the Communications Specialist for the Rock County Public Health Department. And joining me today, we have Katrina Harwood, Health Officer, Michael Niles, Public Health Strategist, and Seth Longcar, Administrative Services Supervisor. And it looks like Nick is not quite on yet, so he is our epidemiologist. He is usually on, he is on. Hold on just a moment. Looks like he just got put into the wrong portion there. So there we go. We also have Nick Zupan, epidemiologist. So we will go ahead and switch it over to Nick, and he will give us some data updates.
All right, sorry about that, new year and technological issues here, but just providing a brief look at the data. Most recently, we have 26,406 Rock County residents who have tested positive for COVID-19. So we are seeing definitely an increase in case activity and levels that we have not seen since last November of 2020. So we're averaging about 170 new cases per day over the last week. We're also getting reports of about 80 new probable cases per day over the last week. So these are people who are testing positive with those at-home test kits that aren't necessarily the PCR tests. We're seeing active case rates of over 3,000. So that's the highest level of known active cases that we've seen over the course of the pandemic. And although we have yet to receive lab confirmation that the Omicron variant has been associated with one of the confirmed cases, it is reasonable to assume that the Omicron variant is currently spreading based on what we've seen in terms of data throughout Wisconsin and our neighboring counties, such as Dane County. There have been 254 deaths due to COVID-19, and most recently we've had 60 patients in the hospital getting care for COVID-19. We have roughly 63% of the population having received at least one dose of the COVID-19 vaccine, and 59% of the population having completed the 2-dose series or 1 dose of the Johnson & Johnson vaccine. And about 1/4 of the population have received a booster dose. So that's all the data I wanted to provide for the briefing this morning. I'll turn it back over to you, Jessica.
Thank you, Nick. I'm now going to turn it over to Seth, and he's going to be talking about our main topic for today.
Great, thank you, Jessica. Today we'll be talking about recent changes in CDC guidelines for isolation and quarantine. As you may know, the CDC recently updated its guidance on recommended COVID-19 isolation and quarantine periods. Now, those who test positive for COVID-19 need to isolate for at least 5 days and wear a well-fitting mask around others at home and in the public for an additional 5 days. Keep in mind that with the current level of community spread, it's recommended that everyone wear a mask in public when around others who are not part of their household. The difference is that those who have tested positive should also wear a mask when around others, when at home or in other private settings during their 5 days of isolation and for 5 days after their isolation. Since someone can be contagious before they know they are positive, it's important that they notify anyone that they had close contact with in the 2 days prior to symptoms or being tested if they do not have symptoms. Those who are in close contact with someone who tested positive for COVID-19 may need to quarantine for 5 days. Those who are identified as close contacts should quarantine if they are ages 18 or older and have completed the primary series of COVID-19 vaccine, but have not received a recommended booster shot when eligible, or if they are not vaccinated or have not completed a primary vaccine series. Those who need to quarantine should also monitor for symptoms, wear a mask around others at home and in public, and avoid anyone who is at higher risk for severe disease for a total of 10 days, and get tested after day 5 or if they start to show symptoms. The CDC says the changes aim to, quote, focus on the period when a person is most infectious, unquote, while facilitating individual social and well-being needs, return to work, and critical infrastructure maintenance. We would also like to stress that schools, childcare facilities, and other businesses may be in the process of updating policies to align with recent updates to these requirements. Please continue to follow the requirements of your employer or school for quarantine and return to work or school. Other CDC guidance changes have included some vaccine-related guidance in the last couple of days. As of yesterday, they've expanded booster shot eligibility to include 12 to 17-year-olds. If and when the Wisconsin Department of Health Services issues similar recommendations, vaccinators in Wisconsin will begin giving booster shots to that age group. CDC has also recommended that anyone aged 12 and older who received the Pfizer vaccine for their primary series receive a booster shot 5 months after their second dose, rather than the previously recommended 6 months. Again, if and when the Wisconsin Department of Health Services issues similar recommendations, vaccinators in Wisconsin will follow this recommendation. Thank you for attending today. Back to you, Jessica.
Thank you, Seth. Before we open up to questions, I'm going to have Michael give us some additional updates.
Thanks, Jessica. So with children returning to school this week, we wanted to share some tips on preventing illness and hospitalizations in this age group. We all know the Omicron variant is spreading rapidly in Wisconsin and the rest of the United States. Early data shows that Omicron is more transmissible than previous strains, including Delta. In some regions, the number of new Omicron cases is doubling every 2 to 3 days. And in Wisconsin, the largest proportion of daily new COVID-19 cases is being reported in children under the age of 18. Since children ages 5 to 11 are not yet eligible for booster doses, they are at a greater risk of more severe illness from Omicron. Several states have reported increases of about 50% in pediatric admissions for COVID-19 in December. In New York City, saw a 4-fold jump from just 2 weeks ago. We know these increases in hospitalizations seem a bit confusing, given that Omicron appears to be causing milder illness in both adults and children. But this is the direct result of the rapid increase in the number of COVID-19 cases in children. Increases in infection translates into more instances of severe illness and more hospitalizations, even though Omicron is milder in most cases. Because of this, we're urging parents to act. We recommend that all parents and caregivers give their child vaccinated for COVID-19, including getting a booster dose when they're eligible. We also recommend that children wear well-fitting masks in indoor spaces, including and especially in school settings. We also recommend that you get your child tested for COVID-19 if they have symptoms. And finally, we recommend that you get your child, or you keep your child home to isolate and quarantine if they test positive for COVID-19 or are exposed to COVID-19. This means keeping them home from school and other activities. We can work together to reduce the chance of severe illness and lower hospitalization rates by following these guidelines. Given the rapid increase of COVID-19 infections, COVID-19 vaccination and testing is more critical than ever. There are many convenient vaccination and testing options throughout Rock County. For vaccinations, the Rock County Public Health Department offers free vaccinations every Wednesday from 3 p.m. to 7 p.m. at our north office located at 3328 US Highway 51 in Janesville. Appointments can be made by visiting rebrand.ly/rcphd-covid-appt. Walk-ins are also welcome at this clinic. We are also working with the DHS and AMI hosted community-based vaccine clinic located at 1900 Center Avenue in Janesville to provide free vaccination. The clinic's regular hours are Tuesdays, Wednesdays, Thursdays, and Fridays from 11 a.m. to 7 p.m. and Saturdays from 11 a.m. to 3 p.m. Registration is available at vaccinate.wi.gov. Walk-ins are also welcome at this site as well. You can also visit rockcountyshot.com or vaccinefinder.org to find a provider and location that works best for you. If you need a free ride to a COVID-19 vaccine clinic or appointment in Rock County, call 211 for assistance. For testing, you can utilize home tests or visit one of the many testing sites available in our community. The state of Wisconsin and Vault Medical Services have teamed up to offer a COVID-19 home testing option for everyone who lives in Wisconsin with or without symptoms at no cost. This service allows people to collect their own saliva samples for testing in their homes. You can request a free at-home test by visiting learn.vaulthealth.com/Wisconsin. You can also access the link I just shared to order a home test via the location or via the testing selection on the Rock County Public Health website. Our testing page also describes the many in-person COVID-19 testing locations available in Rock County. Visit rebrand.ly/rcphd-covid-testing to search for the option that works best for you. And I will turn it back to Jessica.
Thank you, Michael. So that concludes the public health comments for this media briefing, and we will now open it up to some questions from the media. Looks like today we have one media partner in attendance. We have Austin Montgomery from the Beloit Daily News. So Austin, we will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Hi guys, thanks for doing this as always. First off, just wanted to start off asking about hospitalizations. How does Rock County's hospitalization rate right now compare to kind of the national average of what we're seeing? And is that number that Nick provided of 60 hospitalizations, is that as of today or yesterday? Thanks.
Thanks for the question, Austin. So the number I provided is the number as of today. And in terms of our hospitalizations, we are seeing similar levels across the state of Wisconsin in terms of high levels of COVID-19 hospitalizations and very little hospital capacity at this point. Unfortunately, we're not alone in terms of capacity in Wisconsin and also parts of Illinois as well. We're hearing from our partners that there's just very limited bed availability at this point due to the increases in COVID-19 hospitalizations.
And just another one about hospitalizations. Have we seen, I know early in December we had for one of the media briefings, one of the focuses was on just that very topic, hospital capacity. Where is the hospital capacity at right now? Is it still around 2%, 2 to 5%? Just wanted to check in to see if that number had changed and where that was at. Thanks.
Yeah, and any given day, there's anywhere from kind of 0 to 5% bed availability. Our healthcare partners are working extremely hard to make sure that there's capacity for anyone who needs treatment, whether it's for COVID or otherwise, but they are operating at very, very thin margins in terms of anywhere from kind of, like I said, 0 to 5% bed availability on any given day.
And Nick, I know one of the numbers you had referenced to was the rate of booster doses at around 25%. Is that number pretty low? Is that something we're seeing across the state as kind of being around that 1/4 of the population receiving booster doses? Just wanted to kind of gauge where that figure was at, if the health department thinks it needs to be higher than that. Obviously right now with the increase in active cases and new cases that we're seeing, I'd assume so, but just wanted to get some clarification on that and get a response on the current rate of booster doses in Rock County. Thanks.
Sure. Yeah, the current booster rate, 25% of the population is a number that I wish were higher. I think that the booster dose right now is one of the best protection measures we have for protecting people from getting severely ill. In terms of how we compare to other areas of Wisconsin, I'm not exactly sure. There's not great data available on the state website in terms of other locations and the percent of population that have received a booster dose. Right now, I think 50% of our population who is currently eligible for a booster dose has received that booster dose. So we do have a chunk of people, about 40,000 individuals who are eligible for a booster dose and have not yet gotten that. So we're just encouraging people to get the booster dose. We continue to see that the vaccine prevents severe illness and death. When we look at the data, over the last 3 months, we're seeing a 6-fold increase in hospitalizations and deaths among people who are unvaccinated compared to those who are fully vaccinated. So again, encouraging people to seek out those booster doses if they're eligible, and taking a look at our website or rockcountyshot.com will help you get more information about where you can go to get a booster shot.
Last question here. I know, Nick, you kind of just touched on it, just with that, the vaccination page that you guys have that you update daily. With that, I think one of the topic or one of the sections is number of doses by manufacturer, including booster doses. Is that number of booster doses accurate? I just want to make sure, just so when I'm referencing that, just to get the time frame of if that's updated daily or if that's something that kind of gets updated periodically, because I know there can be some differences in reporting for vaccine numbers just as they come in.
Yeah, in terms of the vaccine dashboard that you're referencing, the booster doses in that graphic related to the manufacturers is updated every weekday, and it is the most up-to-date information we have in terms of people who have received the booster doses and how many booster doses have been administered. So that's as current as we have, and it is updated on a daily basis.
Thank you for taking my time, guys, or taking my questions, guys. I really appreciate you all taking the time for this. Thank you.
Thank you, Austin. So it looks like we have no more questions for today, so we'll conclude the briefing. These media briefings take place every other Thursday on our Facebook page at 11 a.m. They are live streamed, and the recordings are available afterwards on our Facebook page and YouTube channel. I also want to invite everyone to join us next week on Friday at noon for our other regular live stream event, which is Numbers with Nick. In this live stream, Nick talks a little more in depth about the COVID-19 data. This week, we are hoping to have a representative from the city of Janesville join us for that live stream event to talk a little bit about the wastewater treatment surveillance that is going on in the city of Janesville. So be sure to join us for that. That takes place on the alternating weeks on Fridays at noon. So I want to thank everyone again for your participation today, and thank everyone who's been watching us via Facebook. If you're a member of the media and you would like to participate in future media briefings, please send me an email at media.publichealth@co.rock.wi.us, and I will provide you with the link to be able to participate and ask your questions live on these briefings. So until next time, everyone, be safe and be healthy.